Hi, everybody. I'm Morgan Davidson, and I am the Director of Marketing and Communications for the Canadian Liver Foundation. And welcome back to our Meet the Researcher series. As we mentioned in our first video, the goal of this series is really to showcase and introduce you, our community, to the many researchers we fund and work with who are doing the work to help advance prevention, diagnosis, treatment, and even find cures for liver disease. Since June 10th marks International NASH Day, and we're talking a lot about NASH this month, I'm really pleased to be joined by one of the founders and members of CanNASH, which is a collaborative organization of healthcare professionals across Canada with a primary interest in enhancing the understanding, care of, education, and research in people with non-alcoholic fatty liver disease or NASH, with a vision of best practices for this disease state. I'm with today Dr. Giada Sebastiani, and I'll tell you a little bit more about her before we jump into her questions. Dr. Sebastiani is an associate professor of medicine at McGill University and clinician scientist at the Research Institute of McGill University Health Centre in Montreal, Canada. She provides clinical services in the Division of Gastroenterology and Hepatology. She received a medical degree and specialized in internal medicine at the University of Padua. Did I say that right? Italy?
Yes.
She has training in clinical and basic research at Harvard Medical School, the University College of London, University of Bordeaux, and Lady Davis Institute for Medical Research in Montreal. Her work focuses on fatty liver disease, liver fibrosis, and non-invasive diagnostic tools in liver disease, with a current focus on at-risk populations, including people with HIV, diabetics, patients with inflammatory bowel diseases, and women with polycystic ovary syndrome. Additionally, she was the chair of the first international workshop of the Canadian NASH Network in 2021, which was a joint event with the single topic conference of the Canadian Association for the Study of the Liver. So Dr. Sebastiani knows a lot about the liver. She's a great person to have with us today. Thank you so much for your time. I'm so glad to have you.
Thank you, Morgan, for the kind introduction. It's a pleasure to be with you and with all the supporters and patients interested in Canadian Liver Foundation and in liver diseases.
Amazing. So why don't we just start right at the top? I know I gave a brief background on CanNASH, but could you share a little bit more today about the organization and what you do, and more specifically, your role within CanNASH?
Absolutely. So the Canadian NASH Network, as already you outlined very nicely, is a national collaborative research network, which really focuses on non-alcoholic fatty liver disease and NASH. I am founding and steering committee member of this national network, together with Dr. Swain, Ramji, and Patel, which represent Alberta, British Columbia, and Ontario, while I am based in Quebec, in Montreal, as you already said. The Canadian NASH Network was established in October 2018, and it is a special interest group of the Canadian Association for the Study of the Liver. Our overall goal is really to build the research capacity around this very important liver disease, translate evidence into practice policy, and promote a global and Canadian effort into non-alcoholic fatty liver disease, which really we consider as a silent killer. And in fact, the first International NASH Day was called a silent killer. In fact, we really think that non-alcoholic fatty liver disease will become one of the most important public health problems in the next years. And currently, as you know, the prevalence is 25% in the general adult population. This means that 1 in 4 Canadians have a non-alcoholic fatty liver disease. So our network really focuses on this disease, very frequent and mostly asymptomatic, and we want to target frequency, risk factors, diagnosis, prevention, and treatment of the disease. As you said, I was recently actually the chair of the first international workshop of the Canadian NASH Network, and we did a joint event with the Canadian Association for the Study of the Liver, and we really were amazed by all the international research around this topic, and we liaisoned with this meeting with the most important leaders in the world on the disease, so we really would like Canada to be at the forefront of this kind of research in this disease.
Yeah, it really is such a prevalent disease, and one that we hear in our community so often, so many people sharing stories of being impacted by NAFLD and NASH. So there's no question that having people like yourself dedicated to this work is so important, and obviously a huge priority for us at the CLF. Can you talk a little bit more about maybe some of the more specific research either you're doing or that CanNASH is looking at that's related to improving liver health, and I guess more specifically with NAFLD and NASH?
Yes, absolutely. So as Canadian NASH Network, we already did 2 specific researches which have been published last year and one this year. The first was on the modeling of the frequency of the disease. And we found that in the next 10 years, unfortunately, the prevalence of disease will increase by at least 20%. And this is really, we will have almost 10 million people in Canada affected by non-alcoholic fatty liver disease by 2030. The other research study that we just published as Canadian NASH Network was a survey among healthcare professionals, and we found that still the knowledge around NAFLD is suboptimal, even among healthcare professionals. So that's why we think that it's very important to promote knowledge and educational plans around this disease. Specifically for my research program, I have built a research program which is at the forefront for non-invasive strategies, basically to diagnose fatty liver disease and liver fibrosis. Liver fibrosis is the scarring that occurs when there is chronic inflammation in the liver, and most of the chronic liver diseases, such as fatty liver or viral hepatitis, actually lead to this scarring or liver fibrosis. So at my center, I basically, with this non-invasive diagnostic center that is based on some non-invasive ultrasound called FibroScan and some serum biomarkers, so to avoid basically liver biopsy, I already screened over 6,000 patients with liver disease since 2013. And because of this research, basically my research was influential on policymakers because Quebec became the first Canadian province to reimburse FibroScan in 2014. Wow. And this is an example, I think, how research can actually impact and inform policy changes. So research can really change policies. And with this diagnostic center, I screened over 1,000 patients with HIV and fatty liver disease. And this is one of the most known cohorts now studying fatty liver and liver fibrosis in people living with HIV in the world. In fact, I am collaborating with 30 researchers across Canada, international, and across 9 countries. And I also screen other populations at risk for fatty liver disease and liver fibrosis, as you mentioned before, Morgan, patients with diabetes or obesity, patients who have received a liver transplant, patients with inflammatory bowel disease, and ladies with polycystic ovary syndrome. So I think it's really important to underline that when we do research and we use, for example, in my case, non-invasive tools, we both improve the quality of life of patients because we reduce the need for liver biopsy, and we also inform a lot of information on the diseases, like the frequency, the risk factors. So I think it's very important to continue with these research programs, especially around fatty liver disease, which is so frequent and still not very known.
Yeah, I really appreciate you kind of painting that picture of how research can lead to some of those frontline changes. I think, especially when you're, in the community, and if you're a donor or a supporter of the CLF, when you give a donation, you're funding research. But what does that mean, and what will that actually? What kind of impact will that actually have? So, I love that. That's such a great point to make. That it really is. Yes, the research is one piece, but what the research can then lead to, and what it can do, and then have that direct impact on care and progress, and ultimately, continuing to work towards that goal of imagining a world without liver disease. So, as far as what you're working on now, I'm curious what excites you the most about the research you're working on, or progress being made in the study of liver disease. What are you feeling most optimistic about?
Yeah, I think that most of my research program, as we discussed, targets non-alcoholic fatty liver disease, and I think progresses that have been done in the past year are amazing through these non-invasive tests, through understanding also in the pathogenesis, so in the cause of the disease. So we know now that the importance of obesity and diabetes, for example, for non-alcoholic fatty liver disease. So we need to more and more to target these at-risk populations. We know that this is a silent killer, that in most of the cases, it's asymptomatic until there is liver cirrhosis. So it's important to know about this disease. And I think progresses have been made in this sense. Also, something that is extremely exciting in the last 3 to 4 years is that there are several therapeutic agents actually in the development to treat liver fibrosis in non-alcoholic fatty liver disease at the global level. So there are many Canadian centers who are participating to these studies, which are very important because hopefully one day we will have several available medications to offer to our patients. And overall, outside the field of NAFLD, I think it's so exciting that supported research led, for example, to incredible advancement in the treatment for hepatitis C, for example. So we know that in the past years we have available treatments which are able to clear the infection in 95% of patients. So it's very exciting how research can improve the life of patients and how it can really change significantly and sometimes dramatically the face of a disease. So I'm very excited about research, obviously.
Yes, it's amazing. It always kind of blows me away when we see the kind of research that's coming out and the progress being made, and that's what makes it such an exciting place to work, because it's really exciting to witness the amazing work people like yourself are doing. I guess switching gears, and just for our community to get to know you a little bit better, what do you love the most about your job?
Yeah, that's a fantastic question, Morgan. I love everything about my job. I love being a clinician scientist because I'm seeing my patients, and I have also protected time to conduct my clinical research. I love improving the lives of my patients suffering from liver disease, and at the same time, I love conducting clinical research because this can lead to important discoveries, and as we said before, together, which can influence guidelines and also change policies, leading to some non-invasive tests, for example, to be reimbursed, or to new medications for hepatitis C to be available for the patients. Me specifically, I am so glad, for example, to be panelist in several international guidelines, such as the European Association for the Study of the Liver. There are guidelines that we are producing on the use of non-invasive tests in liver disease. I am also panelist in the consensus on the on the clinical care pathways for patients with fatty liver disease on the International Liver Foundation. And I am the sole representative of panelists from North America in the European AIDS Clinical Society guidelines, where I specifically give my expertise on non-alcoholic fatty liver disease. So I think it's really exciting to be a clinician scientist, because you see your patients, you care for your patients, and at the same time you work in parallel to change policies, to improve guidelines, which at the end, of course, will improve the life of patients living with liver disease. And I have to say also that as a clinician scientist and academic, for me, it's a privilege, for example, to collaborate and interact with the opinion leaders in the field of hepatology, of fatty liver, both at the Canadian and international level. It's really a privilege. And finally, what I also love about my job is that I love inspiring young doctors to pursue a career in hepatology and in liver-related research.
It's amazing. You sound so busy, but I'll ask this question anyway. When you're not at work, how do you like to spend your time? I mean, I know we've been in the pandemic life the last year, but how do you like to step away from your work and take a break?
Yeah, I think it's always very important to balance science, medicine with some activities that can actually inspire you even, and inspire in your research studies. For example, me, I love cooking. I cook for my two children, my husband, and when there was no pandemic, of course, for my friends. I love cooking Mediterranean diet dishes because I am Italian, and the Mediterranean diet happens to be also so healthy against fatty liver disease, diabetes, and cardiovascular disease. So I think I am quite good cook. I also love running, and I am, since the beginning of the pandemic specifically, I'm running 40 kilometers per week, every week. Wow. Yeah, and I have actually done already 2 half marathons, and one was for the fundraising of the Canadian Liver Foundation last year. And I plan, if everything goes well, to run a full marathon soon at some point. Finally, I also love playing the piano. I am a pianist since many years, of course, a completely amateur pianist. I love especially Beethoven, Schubert, and Mozart. And finally, I love classics in the reading, in the literature. I read French classics like Stendhal and Flaubert, and English classics like Bronte, Austen, and Wilde. So I love the combination of these activities with medicine, and they actually inspire me, I have to say, in my research.
Yeah, and part of the reason why we're doing this is because when you think of, scientists and researchers, you think of those, like that's your discipline, and it's a very, it's not the arts. It's not, a field like that. But what I'm loving about this series is getting to know that our researchers in the community, have that appreciation, and when they do step away, you balance out your life you fill it with all these other wonderful things, and that's so impressive that you're planning to run a full marathon. The longest run I've ever done is a 10K, and the thought of even a half marathon is very intimidating to me. So that's really impressive. I guess last but not least, if you had to choose another career unrelated to what you do now, what do you think you would do?
I would have been a writer. I love fiction novels. I think I have a quite fervid fantasy and imagination. I love writing, especially in my mother tongue, obviously, which is Italian. I have written several poems already and a couple of fictional novels. I just love sometimes letting my fantasy go in different worlds, epochs, or dimensions, and write about different lives. And I think this really helps also, like balance pressure or sometimes even inspiring, as I said before, my research. Yeah, so it's
yeah, I love that you have you flex that left and right brain, it sounds like, pretty frequently. So that's really wonderful. Well, that's all the questions I have. It's been really nice to connect and get to know you a little bit better. If people want to, I guess, keep up with the work that CanNASH is doing, can they find you on Facebook or Twitter?
Yes, we have a website already, which is cannash.ca, and we are planning to open a Twitter account soon. And we have already a hashtag, which is CanNASH 2021, where it is possible to follow, for example, updates from the conference that we did in April or other things that we are posting.
Amazing. Thank you so much. This was so lovely.
Thank you, Morgan, for your time. And I hope really there will be more and more interest in liver diseases.
Yes, I'm sure. And I hope that we continue to see progress, especially with NAFLD and NASH. We know, this month is such a good month to talk about it, but we try to talk about it all the time at the CLF and raise awareness because, as you said, it's so prevalent, but probably not talked about as much as it should be. So anything we can do to also help raise awareness about that, we're happy to do.
Thank you.